The Hill Laboratories AirFlex is designed with a perfect blend to both help improve your performance as a doctor while retaining maximum patient comfort and success. The AirFlex is an air-powered, full-featured manual flexion and distraction table with the option of adding air-powered drops and automatic functionality for both flexion and distraction. The versatility and many options that are available with the AirFlex provide doctors with a custom-built table to treat patients in their own way. All tables come with electric elevation from 21.5 inches to 29 inches or from 22.5 inches to 30 inches. Every AirFlex comes with a tilting headpiece that can lock anywhere from 30 degrees positive to 30 degrees negative. The table also comes standard with a thoracic release section that can lower and lock in any position. The foot end of the table has an adjustable slide-out ankle support to accommodate taller patients. Preparing a patient for a flexion treatment is easy. First, position your patient on the table and secure their ankles with the ankle straps. Pull the foot section out to tighten the slack. With the green power button on, select the distraction button and use the pressure pedal to distract your patient. Palpating the lumbar region will help determine the amount of distraction the patient is receiving. With your patient in distraction, insert the tiller bar into the foot end of the table and select the flexion button. Because the AirFlex uses air to counterbalance the patient's weight, preload the flexion air pressure to about 30 to 50 psi. While holding the end of the table, disengage the flexion handle by turning it to the 3 o'clock position counterclockwise. Then, counterbalance the table to a horizontal position using the pressure pedal by increasing or decreasing the air pressure. Once the patient is perfectly counterbalanced, you can manually flex your patient with ease. To use lateral movement with flexion, disengage the lateral handle counterclockwise. This combination will allow you to perform smooth and effortless circumduction. The table also comes with rotation, which uses a double locking system. Disengage the large centering handle, and then unlock the switch to rotate the pelvic section freely. From there, you can treat at a specific rotation angle by locking the switch. When the treatment is finished, select distraction and use the pressure pedal to retract the table and your patient inwards. Since the AirFlex uses air-powered flexion, adding up to 4 air-powered drops is an option, all controlled by the pressure pedal or foot strips shown here. The cervical air drop contains 2 drops and 1 headpiece. The first is a forward motion drop. Pull and rotate the black pin just below the cushion to convert the forward motion drop to a straight down motion drop. Adjust the tension knob to control the amount of force required to use the drop. The second air drop available is the thoracic drop. Again, use the tension knob to adjust the level of firmness. The third available airdrop is the lumbar drop. The fourth optional airdrop is the pelvic drop. With the airdrop system, you have the ability to use multiple drops simultaneously. The headpiece options include a raised headpiece, assisted with a gas-powered cylinder. It can rise and lock anywhere up to 5 inches. Manual cervical flexion is also available on the AirFlex. To use cervical flexion, secure the straps around the occipital region of your patient and disengage the tilting lock. Only a small amount of flexion is needed to produce successful results. Disengaging the rotation lock will allow for gentle circumduction and flexion. The thoracic section options include an air-powered thoracic spring breakaway. Preload the air cylinder to counterbalance the patient. This is used to maximize patient comfort while adjusting or while performing soft tissue massage. The AirFlex also has the option of automatic lumbar flexion. To use automatic flexion, set up the patient on the table the same way you would for manual flexion. Make sure the patient is perfectly counterbalanced and in a slightly flexed position. The 6-inch touchscreen panel offers digital accuracy for controlled, fully repeatable treatments. Use the touchscreen to adjust your desired settings for flexion depth, speed, flexion hold time, and rest time. You can also adjust the amount of cycles for any given treatment. When all desired settings are entered, touch the green Run button. The Run button will activate the automatic flexion motor. Turn the flexion handle to the 1 o'clock position to start treating with automatic flexion. You may insert the tiller bar and perform circumduction with the tips of your fingers without pushing down or bending over. Adding the option of auto distraction turns your AirFlex into an effective traction table. Use the provided seatbelt to help stabilize the lower back of your patient. Use the touchscreen to control your automatic traction settings. The rest setting controls the seconds that the patient will be in a rest cycle. The pull setting controls the seconds that the patient will be in the pull cycle. The rest percentage setting controls the force during the rest cycle. This setting is limited to 50% or 25%. For example, with a force setting of 40 pounds during the pull cycle, setting the rest percentage to 50% will administer 20 pounds of force during the rest cycle. The time setting controls the total amount of time for the treatment from beginning to end. Tap the manual button to switch to automatic mode and set the force setting.
The treatment force is measured in US pounds. It is programmable from 25 pounds to 100 pounds for a lumbar treatment and 3 pounds to 50 pounds for a cervical treatment.
When all desired settings are entered, touch the green Run button to start the treatment. Your patient will now experience traction that is smooth and consistent. During a treatment, all of the settings on the touchscreen will display actual values in real time, so you can monitor what is happening when it is happening. For first-time patients, it is suggested to use manual mode to distract and palpate your patient to determine the right amount of force needed. Pressing the Run button from there will use the desired amount of force as the maximum setting. During auto distraction, you may lock the patient in any flexed position. You can isolate one leg when treating sciatica by simply unstrapping one of your patient's ankles. Lateral positioning may also be used safely during automatic distraction. To use automatic cervical distraction, gently position the patient's occipital region into the upper inside ridge of the cradle support with the insert pad facing the ceiling. Tighten the tension knob until the patient feels a slight inward pressure. Secure the forehead straps and tilt the headpiece about 5 to 10 degrees. Pull and rotate the red pin located underneath the headpiece cushion. This will unlock the headpiece so that automatic distraction is possible. If the patient experiences discomfort, they can use the emergency cutoff switch. The table will then stop the treatment and return to a full resting position. To program a cervical treatment, touch cervical to activate the cervical mode. Settings for cervical distraction follow the same procedures as for lumbar distraction. Set your rest time, pull time, rest percentage, treatment time, and force. When all desired settings are entered, touch the green Run button to start the treatment. The table comes in 3 base colors: beige, black, or gray. There are also 20 attractive top colors to choose from. All Hill tables are backed by a comprehensive 1-year warranty. The AirFlex table continues to revolutionize flexion distraction practices. Once you've treated with an AirFlex, we're confident you'll never be satisfied with an ordinary flexion table again. Hill Laboratories has been a leading manufacturer of chiropractic, physical therapy, and medical treatment tables since 1945. For questions and ordering, call us toll-free at 1-877-445-5020 or visit hilllabs.com.